Hello everyone, and welcome to our course on managing behavioral symptoms in Alzheimer's. I'm Chantal Bernard, and I'm thrilled to guide you through this important topic. As caregivers, family members, or healthcare professionals, understanding and managing behavioral symptoms is crucial for providing compassionate care to those with Alzheimer's. Let's dive in and explore effective strategies together. Let's start with Module 1. Understanding behavioral symptoms in Alzheimer's. In this first module, we'll explore what behavioral symptoms are and why they occur in Alzheimer's patients. Behavioral symptoms can include agitation and restlessness, wandering, sundowning, increased confusion in the late afternoon and evening, aggression, verbal or physical, paranoia and suspicion and repetitive behaviors. Behavioral symptoms such as agitation, wandering, and sundowning stem from brain changes or unmet needs. Each behavior is an attempt to communicate. For example, wandering may signal a need for movement or comfort. Remember, these behaviors aren't intentional, and understanding their source is key. Now let's proceed to Module 2, Common Triggers and How to Identify Them. Now let's talk about what can trigger these behaviors. Identifying triggers is key to prevention and management. Common triggers include changes in environment or routine, overstimulation, noise, crowds, etc., physical discomfort or pain, medication side effects, and fatigue or lack of sleep. Triggers vary and can be physical, emotional, or environmental. Cultural background and past experiences may influence reactions, so consider these personal factors. Use a behavior log like the ABC chart, noting antecedents, behavior, and consequences to reveal patterns. This will help identify triggers specific to each person. Now we are in Module 3, Communication Strategies. Effective communication is crucial when managing behavioral symptoms. Here are some strategies to try. Speak clearly and calmly. Use simple, direct language. Ask one question at a time. Be patient and allow time for responses. Use nonverbal cues, gestures, facial expressions, and validate feelings, even if you don't agree with the reality. Effective communication relies on clarity, patience, and validating emotions. Try redirection if they're upset, or gently ground them with familiar details. Watch their nonverbal cues. Sometimes a look or posture says more than words. Your tone, patience, and body language can make all the difference. Let us dive to Module 4, Environmental Modifications. Our environment can have a big impact on behavior. Let's look at some ways to create a calming, supportive space. Reduce clutter and noise. Ensure adequate lighting to prevent shadows that might cause confusion. Use clear labels on doors and drawers. Create a designated safe space for retreat when overwhelmed. Maintain a consistent daily routine. And use familiar objects and photos to create a sense of comfort and familiarity. These changes can significantly reduce anxiety and confusion, leading to fewer behavioral issues. Let us proceed to Module 5, Activity and Engagement. Meaningful activities can prevent boredom and reduce challenging behaviors. Here's how to approach activities. Focus on the person's interests and abilities. Break tasks into simple steps. Emphasize the process, not the outcome. Incorporate music and art, which can be soothing and stimulating. Encourage safe physical activity, like short walks or seated exercises. And include sensory activities, like sorting objects or folding laundry. Remember, the goal is engagement and enjoyment, not perfection. Meaningful activities reduce anxiety. Choose based on personal history, familiar music, favorite hobbies, or even reminiscence therapy can be impactful. Consider low stress. Hands-on options like folding towels or gentle exercises. Simple, enjoyable activities keep them engaged without frustration. And lastly, Module 6, Self-Care for Caregivers. Taking care of yourself is just as important as caring for your loved one. Here are some self-care strategies. Practice stress reduction techniques like deep breathing or meditation. Join a support group to share experiences and advice. Take regular breaks, even if they're short. Maintain your own health with regular checkups, exercise, and a balanced diet. Ask for and accept help from others, and celebrate small victories and moments of connection. Remember, you can't pour from an empty cup. Taking care of yourself allows you to provide better care. As we wrap up, remember that managing behavioral symptoms in Alzheimer's is a journey. It requires patience, flexibility, and compassion, both for the person with Alzheimer's and for yourself as a caregiver. The strategies we've discussed, understanding triggers, effective communication, environmental modifications, meaningful activities, and self-care, are your toolkit for this journey. Use them, adapt them, and don't be afraid to seek additional help when needed. Thank you for joining me in this course. Your dedication to providing compassionate care makes a world of difference. Keep learning, keep growing, and remember, you're doing important work. Take care, everyone.